Thank you, Dr. Radhamurthy. I am very happy, although the crowd has thinned out, but still lots of people have stayed put. And I hope at the fag end of the last day of the conference, I am not violating your human rights. Now, you may wonder that I may have a legal background. I am not a lawyer. Why I have been asked to speak on rights of the elderly? I am actually a doctor by profession, like many of you sitting in the audience. But I think I have been picked up to speak on this subject because I am also a member of the core group of the National Human Rights Commission. And since 2009, so I have been dealing with this subject fairly recently, and I hope to highlight some of the points which are relevant particularly to our country. Now, there are standard values in medical ethics applicable to all segments across our society: autonomy, beneficence, non-maleficence, justice, dignity, and truthful honesty and informed consent. These are the general principles of medical ethics which a doctor or a health providing institution must observe. Right to health is interwoven with other human rights. Older persons can enjoy right to life, right to dignity, right to security, or right to decision making and contribute to development process only if they remain healthy and active. If they are frail, they are ill, they have a lot of health problems which are uncontrolled, they simply cannot enjoy the other human rights. The second thing is, I think we must distinguish between duty to provide. Normally what we have been always talking about, that we have to give this facility, we have to give that facility to the older person. So it is a duty to provide. But I think our paradigm must shift from duty to provide to right to receive. Elder people have a right to receive the care. We are not doing any favor to them by giving any health services. Similarly, we should also distinguish between responding to the health needs of older persons from realizing the health related rights of older persons is all what is important from the perspective of human rights. And I would explain as I go by. Now, it is quite clear, so many speakers have already highlighted, but I would like to say that within 50 years, between 2000 and 250, the entire India's population will increase by 55% only. But the population of 60 plus will increase by 326%, and the population of 80 plus will increase 700%. So the 80 plus people, and that is very old people, are rising in their proportion at a highest rate. And particularly coming to our country, enormity of this speed of this burden that we are witnessing, together with impoverishment of older persons particularly, human rights are violated almost daily in this country. So is it something that we can do about it, or it is still a far cry? We'll discuss it. So I have already said something about it, that millions of Indian elderly are used to poverty without nutritious food, safe water and health-friendly shelters. Many of the remaining millennials face several barriers to right to health, and in order to realize these rights, serious and constructive steps are required to empower these persons. Now, if you leave the left column and the middle column, the left column only says the diseases which occur in elderly more often, although they also occur in younger persons. But in the middle column, there are diseases which almost exclusively occur in elderly. Leave aside these columns. What I would like to emphasize on the right hand column, that is the third column. The third column enlists certain symptoms which happen as the person becomes older and older, may not have any disease whatsoever or may have a disease. These are, for example, fatigue and reduced strength. Many older people complain of reduced mobility, reduced sleep or disturbed sleep, reduced memory and reduced sight, constipation, loss of appetite, impaired hearing, dryness of the skin, kind of body pains, shortness of breath, incontinence and impotence. Now these may exist with diseases, but they may also exist without diseases. These are the actual signs of aging. And I can assure you that many of the doctors, including myself, we do not know how to treat them. We know how to treat diabetes, we know how to treat blood pressure, but we do not know how to treat those signs of normal aging, which is also a morbidity for the older person personally. So, in a survey, the Agewell Foundation, they surveyed 50,000 people and they reported every third older person is not getting proper medicine and health care, with women being more vulnerable in our country. And more specifically, violations which are health related, they occur as abuse and rough treatment, bullying attitudes in various institutions, age discrimination, mistreatment, neglect in hygiene and nutrition, and hasty discharges. Vulnerables are particularly more susceptible to such violations. Dementia is one example. This is a study done by HelpAge India both for the rural elderly as well as urban elderly. The blue bars represent the percentage of elderly abuses in terms of rural elderly, and the red bars indicate the similar data on the urban elderly. You would find that the lack of health care is the largest single abuse in the rural elderly, amounting to 31.6%. There are other matters of abuses also which I am not dealing. I am only talking today about the health related human rights. Now, these pillars of health care in any country, like availability of care, accessibility of care, adaptability of care and quality of care, they are not robust in our country at all. Many people do not have access, many people do not have available, and certainly many cannot afford, and it is also not acceptable to many people. So these are very, very weak pillars in our society. So what are the talking points from this perspective? I would like to say that in our country, there is a huge role of traditional carers. Who are traditional carers? These are families, communities, the civil society, a large number of non-governmental organizations, and older persons themselves can look after themselves. And utilization of private healthcare facilities and indigenous systems of medicine is quite common, notwithstanding the fact that the public health system is not really very robust. So people, wherever they are, they go to the private healthcare, which sometimes they are costly, but sometimes in the rural areas, the traditional carers may not be very. And implementation in national programs and initiatives which have been highlighted from many years. I have just counted some of the national initiatives just for your information. They may be already known to you. National Policy for Older Persons was established first in 1999 and is recently reviewed and is being put forward as National Policy for Senior Citizens. The approved draft is lying with the Prime Minister's office. It is to be declared. Integrated program for older persons has many umbrellas under it, and it is Ministry of Social Justice Initiative. National Old Age Pension, everybody above the age of 60 now, previously 65, gets an old age pension from the central as well as state. Maintenance and Welfare of Parents of Citizens Act have been referred to. It is one of the latest acts. National Human Rights Core Group I have already referred to. Then there is a National Initiative on Care of Elderly by National Institute of Social Defense, which carries out training of healthcare providers at all levels. Then I think a program on National Program for Prevention, Control of Cancer, Diabetes, Cardiovascular Disease, Stroke, which is there for few years by the Ministry of Health. But the latest, and which is the flagship program in the healthcare, is a healthcare of the elderly, which has been referred to by some speakers earlier. This is intended to cover all the 640 Indian districts over 12 5-year plan with a primary healthcare approach, 10-bedded ward in every district hospital and regional geriatric medical institutes and 2 national institutes on aging. By now I understand that the regional medical centers have been increased from 8 to 11 and the national institutes on aging are under process to be erected. One at the All India Institute of Medical Sciences, New Delhi, other at Chennai. Now, why the violations occur? What are the barriers to realize the health-related human rights? I have tried to analyze this subject and I have concluded that there are 4 major areas due to which the health-related rights get violated. One is by older persons themselves. Older persons have a unique mindset in our population, particularly in the rural areas or amongst the poor people, even in the small cities, towns, slums and shanties. They have a mindset that they have become old. There's nothing that can be done. So they don't even go and try to access the health care, and they silently allow the time to pass while their morbidities are surely and gradually increasing. So this is a mindset. And the same mindset revolves around the family members of that elder person. The families also think the person has become old, and therefore the health related human rights get violated, he doesn't get the health care. The second is the healthcare system itself. So many initiatives I have enumerated, but many of these are state driven, they are not demand driven, they are state driven. And also they lack in home care, in palliative care, in chronic long-term care. These are all lacking in the public system at this time. And you would be very disappointed to know that India, as far as 2009 is concerned, India spent only 2.5% of GDP on health care and ranked 185 in the world. So adequate healthcare financing covers only a minuscule in the form of health insurance. Healthcare providers is another source of barriers to the realization of human rights. They have attitudinal issues. They discriminate against the older people. They lack of quality of life management. They can at best treat certain diseases, but they are not aware of the normal signs of process of aging. And they do not understand, neither they are able to treat them. And they also are coming from different streams. Some people are coming from the IISc stream, some people are coming from modern streams, and there are no answers in modern medicine to everything. There are no answers in IISc for everything. So everything has to be integrated, but this is not happening and this is not existent. Then there are certain groups which are especially vulnerable to the violation of human rights. Those are very old people, or widowed old females, or those who are dependent and bedridden, and some of them are in so remote area they are unreachable. So they are really liable to abuse, false, violence, and inability to carry out their activities of daily living. They are disabled, invisible, and cannot fight back or defend themselves. So we have to empower them. How to empower them? One is education and awareness. I would not go into the detail. I would like to stick to my time. Motivation for self-care is very important. I think everyone, no government in the country or no government in any part of the world can extend financial help for rendering tertiary care or a curative care for their elderly population. So elderly people have to be taught and coached to remain healthy by themselves by adopting certain lifestyle approaches. So that is the motivation for self-care, which includes spiritual care also. Then healthcare system has to be made more effective by a series of measures which I have enumerated on the transparency. And when I was talking of self-care practices, I would like to say that there are 5 basic principles: healthy, balanced vegetarian diet, which is satvikta; physical and yogic exercises, which is shramta; active involvement with life, sakriyata, keep working; social interaction and networking is also important, that is samparkta; and spirituality for peace and relaxation, shaithalyata. 5S translated into Hindi sentences. And empowerment can also be achieved by healthcare providers by changing their curriculum, by training them properly, capacity building for those people. There are both hard and soft skills in geriatric care are needed, and there has to be a sense of volunteering in them which has to be inculcated, and the vulnerable groups have to be particularly looked into, and right to health has to be ingrained in national health policy. Public, private and voluntary facilities should be brought within the scope of human rights legislation, and robust complaint procedure should be in place. These are some of the brief views that I have tried to express, and if there is a time available, if somebody wants to ask, then I would be very happy to say. And I would just like to say that some of these that I have expressed today, I have learned this trait only by attending some of the meetings of Human Rights Commission, and of course through the literature. I am not a human rights activist myself, I am simply a doctor. Thank you very much.
I think we can take one question because he's just finished on.
This is the slide you wanted? Yeah. So it is Satvikta, Second is shramta. Shramta means working. Sakriyata means remain active and keep working. Sakriya hona. Fourth is samparkta. That means you keep sampark. You keep social interaction. And fifth is shaithalyata, spirituality for peace and relaxation. These are just some of the acronyms that I often try to put these acronyms in my lectures. So it is just to easily remember these things, that's all.
Thank you, Doctor.
Thank you.
I think we have the next.
Thank Dr. Vinod for his time. Let's give him a big round of applause. And may I request Dr. Arora to honor Dr. Vinod, please?
It's honor for me.
Thank you once again. Thank you, Dr. Arora.